Welcome to my Facebook Live audio. And we are continuing our journey here of my 30-day report of what I'm doing after I quit my job. I quit my corporate job on July 27th, and I had promised that I would do 30 days of videos, audios to kind of give people an idea of what I'm doing now. So what I wanted to do today, so it's been a pretty fun day. It's been a fun day. I got a lot of things done related to some programs that I'm developing for diabetic coaching to help people reduce their blood sugars and reduce the amount of medications they have to take and even get off insulin. That is one of the main goals, is to get off insulin, to help people get off insulin. So I've been doing some research and, like I said, setting up the program. But much of the information I kind of already know. I've been in the medical field working as a nurse for over 36 years, and I've had my own experiences with diabetes. So what I want to let you know is that I did some research and I thought that this was pretty important. So I figured, like, let me just say what's on my mind about diabetes and what some of the statistics says about diabetes, and because people may not know. So really, when you do the research, there's over 25 million people in the United States that have type 2 diabetes. Now that's just in the United States. They don't even count other countries. So in the United States, diabetes is like running rampant in people's lives, and so that's one of the reasons I have a passion to kind of help people to reverse it, reduce their blood sugars, just to get better, because there has to be a change to happen in this area. So over 25 million people, that's a lot of people that have diabetes. And they have a lot of times the people who have the diabetes don't even know that they have diabetes. They don't know some of the symptoms and the signs because they're just kind of common everyday annoyances, I'm going to say, and they're not anything that seem dangerous, but these are signs that they have diabetes, yet they don't know that they have diabetes, and they're not prompted to go to the doctor about it. So what I want to do today is give you 15 of the most common early warning signs that you may have type 2 diabetes. So number one is that, let me say this too. I'm going to mention 15 symptoms, but just because you have these type of symptoms doesn't mean that you have diabetes. So it would be a combination of several of these, but if you have these symptoms and it feels like they're not going away, you definitely want to go and be checked. Have your blood drawn to see what your blood glucose levels are. So that's what I want to recommend. So, but these are symptoms that some people would just consider just regular, common, everyday symptoms, but they don't associate it with being a diabetic. So here we go. So the first thing is numbness. So people experience tingling in their hands, tingling in their fingers, their legs, and their feet. So this is kind of common. A lot of people have this. This is a usual thing. But sometimes they don't know this. It could be associated with diabetes. So then the second thing, or the second symptom that people may have and don't know that they have diabetes, is that they have an increased urination. They're going to the bathroom frequently, and when they go, it's a lot of urine. So frequent urine with high volume of urine. So sometimes when you see that, that may be a sign to go be checked. Okay. Number three people have weight loss. They have a rapid weight loss that's unexplained, and the reason that they have this rapid weight loss is because their blood sugars are high. They have extra glucose and their body doesn't absorb it properly. So then there's this rapid weight loss that occurs. So sometimes when you have a rapid weight loss and it feels like there's no reason, you're not on a diet, you're not exercising extra hard to try to lose weight, but yet you lose weight, that need to be checked. Okay? Number 4, you have an increased appetite. So you got your sudden weight loss and then you have increased appetite. Those two, they don't go together. So that's a sign that you need to be checked, that you may have diabetes. Number 5, you have blurry vision. And this is one of the common signs when your vision is blurred. Now, the high blood sugars can cause the blurred vision. And then many people with type 2 diabetes, they have problems with eyes and they have the risk of blindness if their diabetes is not controlled. Number 6, they have itchy, dry skin, and that's because of the high blood sugar and because of the poor circulation. And if you're having some of these symptoms, that doesn't mean automatically that you have diabetes. But if you're having it and it doesn't seem to go away, you definitely need to be checked. Okay, so that was number 6. So number 7 is unexplained fatigue. Like all of a sudden, you're tired all the time. You don't seem to be getting enough rest. It's something that's not right. Yeah, you may be overworking out at your job or something like that, but if there's nothing going on and then suddenly you start feeling fatigued a lot and tired a lot for what seems like no apparent reason, then you definitely want to check to see what your blood sugars are. Okay, so number 8, you have an unquenchable thirst. So you're constantly thirsty. You're always drinking water, liquids. And really what's going on is because you got the frequent urination over here, now your body's trying to compensate for it by having you drink more and more and more to kind of balance, because your body doesn't want your body to get dehydrated. So there you are, thirsty a lot to trying to balance out things. So that could be a sign that you have type 2 diabetes. Number 9, you have a slow healing for the cuts and bruises that occur. It doesn't heal quickly. It takes a while for them to heal. That could be a sign that you have type 2 diabetes, or that you may have an increase in your blood sugar. Because the higher the blood sugar, the slower you will heal. Okay? And then number 10, you have irritated gums. Your mouth is sore. Your mouth is red and swollen. Because type 2 diabetics have a tendency to have gum disease. And that's kind of common for type 2 diabetics. So if you have irritated gums, red and swollen, and it just doesn't seem to go away, or you consistently have that, you may want to be tested for diabetes. Number 11, you have a dry mouth. Now, why you have a dry mouth, no one seems to know. But they just know that diabetics have dry mouth. Number 12, you have frequent yeast infections. This is for women. And this is caused because you have a high blood glucose. Your blood sugars are high, so it causes you to have frequent yeast infections. So you might want to be tested to see if you have type 2 diabetes. If this has happened, recurring and recurring and recurring, you might want to be checked for that. Number 13, you have started to see where your body is having dark patches of skin. Now, the dark patches of skin could be seen around, like in the back of the neck, in your armpits, your elbows, and your knees. Now, I don't know if anybody's seen that kind of phenomenon with people who they know is a diabetic. Just kind of think about it. People who you know are diabetics. Many times you will see that their knees and elbows and the back of their neck and their armpits are darker because they have this dark, kind of patchy skin, kind of velvety looking type dark patches of skin. So that occurs because you may have type 2 diabetes. Now, it can be caused by other things, but that is a sign that you might want to be checked to see if your blood sugars are high. And then number 14, men get erectile dysfunction. So there's the problem in the sexual area there. So that could be a sign that you have type 2 diabetes. And then the 15th and last sign and symptom that people may have that they may want to be checked to see if they have type 2 diabetes is that they have frequent and recurring infections, just infections in general, like bladder infections or foot infections, or just infections that doesn't seem to get better. You may want to check to see if you have type 2 diabetes. So there you have it. These are 15 signs that you possibly could have type 2 diabetes. And because what I said in the beginning of this broadcast was that over 25 million people in the United States, just in the United States alone, have type 2 diabetes, and many of them don't even know it. So these are symptoms that are kind of vague symptoms, but they could be a sign that you have type 2 diabetes. And I want to advise, if you have multiple of these, not just one isolated incident, it could be other things, but if you have multiple of these type things going on, then I do recommend that you go to your doctor and get your blood test to see if your blood sugars are elevated. Okay, so that is it for tonight. I wanted to make sure that I give you that bit of information that I thought, well, maybe people don't know, since they're saying that many people have diabetes and don't even know it. They're walking around with it, and before you know it, they're in the hospital with a blood sugar of 400, 500, 600, and they had no clue that they were diabetic. So these are signs. These 15 things that I just talked about are signs, or warning signs, that it's possible that you could have diabetes. And it's just a good habit to, if you're going to your doctor, to have your blood sugars checked on a regular basis. Okay, so that is it. Thank you, everybody, for listening in. I appreciate your support. Thank you for chiming in and staying in touch with what's going on in my journey here. So this is day 12. Take care, and I'll talk to you tomorrow. Bye-bye. Oh, if you like this, I forgot to say this. If you like the information that I just shared and you know someone who could have diabetes, share this video with them. Or if you have any questions or comments, you can put them in the comment section below, and I will try to answer those. Okay, so thanks a lot, and we will talk to you tomorrow. Bye-bye.